first of all, thanks a lot. So my name's Tom Wagoner. I'm head of USI here in Columbus. We're going to give you a little bit of overview about USI here in a second. But just first of all, I want to thank everybody for being here. I know there's some connection issues, so I expect people to be trickling in. But as I said, I've done a lot of these presentations over the years. I've been in business 40 years. And so I like to tell people I'm about a mile wide and a foot deep on these issues. So I've been exposed to a lot, but we have a lot of technical expertise behind us at USI. But if you have any questions during the time, I'd prefer you just go ahead and, rather than use a chat box or something like that, just jump in, because you won't throw me off, and it'll be just fine. So here's a real brief, picture of me. Again, I've been in the business 40 years. Many of you have been on some of the seminars I did in compliance during the healthcare reform in the ACA and tracking and all that. I did all those for Paycor and ADP. So compliance is something I'm pretty well versed in, as well as cost containment and communications and so on. But today we're going to talk about just kind of the challenges that are ahead of clients that we have in the state of Ohio. But before we do, I'm going to let Bob just chime in here with a brief overview of who USI is. Because not that this is not going to be a commercial. We're not here to promote USI. We're here to be strictly informational. But I think it's important for you to know where the information is coming from. So that's the purpose of the next 3 or 4 slides. So Bob, why don't you take it there for?
Yeah. Well, Tom, first, why don't you just tell them how we became part of USI before I get started?
I ran a company called Accelerated Benefits for 30 years here in Central Ohio. We grew to be the largest employee benefit advisor in the state and in the city. And you can see by this map of USI, which has 8,000 employees and 200 offices, their essential business plan is to power local brokers. They usually buy or merge with the number 1, 2, or 3 broker in a marketplace. And then what they do is they try to bring in, or will bring in national technologies and resources like attorneys, attorneys, compliance attorneys, communication people, actuaries, underwriters, and so on, to really provide a value package to the small and medium-sized market that the people like AEB and Worthington Industries enjoy. So our core market is about 2,000 to 2,000 employees, where you get the Willis's, Neons. They don't go down to that level. So we provide that level of service to those groups. So Bob, I'll put it back to you to just kind of go over our process, and then we'll get into the content.
Yeah, so the process really consists of 3 parts. We have an Omni engine, which is an AI engine. It's continuously extracting information from our more than 100,000 clients that we have coast to coast, and determining what is working and what isn't working based on the strategies that we deploy within those clients. So it's pulling, for instance, if we put in a spousal waiver type of strategy in a given client, we will track, what the impact prior to that strategy being put in place was financially and on the employee impact side of the equation, and then that information extracted and put into our analytical model, which is a regression type model that extracts the information and gives us strategies and ideas that we can put in place as we face our existing clients and new prospects, to determine if we do X, then Y will result in typically in putting that type of strategy in place. So anyway, I know that's a mouthful, but anyway, we take those strategies and put those in front of our clients and prospects. And it's not our job necessarily to say, this is what you should do. This is what clients within your industry SIC code, within your demographic area, with the number of employees that you have, this is what those clients are doing. And it may be right for you, but it may not be right for you based on the culture within a given company. But so our job really is to put all the strategies in front of a client and determine, which ones are good fits for those clients. But anyway, you can see from the client, from the slide in front of us, we have a pretty strong bench. So Tom mentioned, that Aon and Willis usually handle the clients that have as many as 5,000 employees and up. And then you have the small local brokers that exist as well. So what really separates us from the small local brokers and even regional brokers is the fact that we have this strong bench. So we have 750 consultants, we have account managers that handle the day-to-day activity, but we also have our own internal underwriters that came from the carriers, and so they kind of know where, for lack of a better term, all the bodies are buried when it comes to renewals and employee benefit packages that a given carrier will offer. So in any given year, once we get a renewal, we'll sit down with our underwriters and they'll tear apart the renewal and figure out if it's fair and equitable. And if not, then that's how we push back against the carrier. So we just don't get a renewal and say, okay, now it's time to negotiate. Well, we're negotiating from a position of strength where we know what the numbers should be, and the carriers know that we know what the numbers should be, and so we go from that perspective. But anyway, we also have a whole team of compliance attorneys that are internal. We have claims analysts that review the claims on a monthly basis to look for the outliers. And believe it or not, carriers do make a lot of mistakes, and we find those mistakes and get them corrected, which has usually a major impact on the spend any given company has on a monthly or annual basis. And then we have our own wellness directors and employee communication experts as well. So anyway, we take all of this. You want to go to the?
I figure we'll go into the content. Thanks for that, Bob. So, and by the way, I put in that slide all of our property and casualty resources as well, because that many of you might be struggling with issues in your property and casualty. Bob and I are in the employee benefit division at USI, but we also have property and casualty and retirement plans. So if you happen to have a workers' comp issue or property or casualty issue, we certainly can help you out, but we have experts behind us that'll do that. So today what we're going to talk about is, and by the way, what we're going to do at the end of this is we're going to send everybody this slideshow, and what you'll see is when we get to each one of these categories, there's content that you can connect to through the slides. So all you have to do is kind of click a topic and you'll be able to go. And so we're going to share this with everybody. But what we're going to really talk about today is managing healthcare costs, a labor shortage that we have, compliance, and a supply chain disruption. But I want to make sure that we don't miss something that might be really important to the people on this call. And I just had a call right before I had this call with the head of the Ohio Concrete Association, and he was telling me with right now, before the whole Intel impact on the local economy, they only have about half the concrete that they need to supply Central Ohio's building needs, and they've had some new laws that go into effect that are making that even worse, and there's international things. But what I see coming with the whole Intel thing is in aggravating some of the labor shortage that we have. And there's two types of inflation. There's cost push and demand pull. Well, everybody's costs are going up because supply chain and things like that, and also the demand for labor is going up and causing problems there. So the bottom line is there's a lot of increase on pressure. So we're going to talk about that a little bit. But can I just ask people in the audience to chime in? Is there anything else that's topical and on your mind, or people from Whalen, if you want to add anything to the agenda that we want to talk about that you think might be more topical than those four on there? Have any takers, Richard?
Okay. I'm going to call out Shara. Shara, I know that you typically have some very good questions. Is there anything specific, starting with you, that you were hoping to get from this workshop this morning?
No, I was just hoping to kind of understand an idea of what we think in terms of costs coming down, and any sort of the inflation effects that we might be anticipating, so we can budget and plan accordingly.
Okay.
And
Definitely.
I'll throw on top of that, Tom and Bob, is that this is going back. I mean, we are, I don't know whether we're past the pandemic or not, but during the pandemic, obviously people were in, they weren't going to the doctor, et cetera. Actually, the cost to the insurance companies was actually down. And we know that that's not really going to be passed through. But any comments you have in that regard would be appreciated.
Will do. Any others? We got Max on there and Judy. You guys want to chime in from your perspective? Okay, well, I'll take that as a no. Let me, Richard, let me just talk about that for just 1 second. What we saw in the pandemic when in 2021 was in 2020 and 21, there was about an 8-month period there where really all elective procedures and things like that were deferred, for lack of a better term. And so we did see a reduction of about maybe 3 or 4% of somebody's spend. So if you go with an average group is spending about $10,000 a year per employee. And so if you take 100 employees would be like $1 million. We would see typically about maybe a $50,000 reduction in their spend in that period of time. But really, that was a deferral that really kind of picked itself back up in 2022 or late 2021. So I think everything started opening up again about September, August of 2021. But so that was like a temporary thing. So you should have felt a reduction. In fact, there were a lot of companies like Delta Dental, and I can think of a lot of the ancillary carriers that gave premium holidays. They actually gave a month free or 2-month free to some of their clients that we were able to negotiate because their utilization was so low. They had guilt feelings, believe it or not. You don't feel like insurance companies have guilt feelings, but they don't work inside of a vacuum. They've got competitors out there. They're going to call them out if they don't do that. So we actually saw, insurance companies giving premium holidays and things like that during that period. But having said that, all the things that we talk about in supply chain and cost push and all that is things that everybody on this call might be experiencing in our world. We're getting in the whole healthcare business as well. I mean, you can imagine the nurses' salaries, how those have exploded, all the support staff, medical equipment, and so on. So here are the 5 topics we're going to focus on today. Is that one, we're going to talk about inclusive benefit strategies, diversity, equity, and inclusion. We were talking a little bit about this before the call, that maybe the people on this call, that's not necessarily the most important thing in their life. But I can tell you at the corporate level and so on, there is a big focus on making sure they keep the eye on the ball of diversity, equity, and inclusion, because it's a big matter right now. So we're going to talk a little bit about that. Alternative care, the whole telemedicine market and so on has exploded in the pandemic. We saw virtual visits go from 2 to 3% of the people participating to 30 to 35% of the people. So that was a strategy that was used. Increased use of technology, bridging gaps in care, and then the labor shortage. So those are the 5 major things. So as I said, each one of these categories, we're going to have like a drop down. So here you got inclusive benefit strategies, and we're going to send this to you. And so what you can do is you can click any one of these blue things, and it'll take you to some subject matter on benchmarking, for example. And I just want to spend a second on that, because I think it was Cher that you said that, managing costs and things like that, many people have no idea how their costs compare to the marketplace. So let's just say I'm talking to a trucking company and they're saying, we know our costs are $10,000 a year per employee, and we have a $5,000 deductible. How does that compare with our market? So as Bob said, we have a omni engine where we can go in there and say, of our 100,000 clients, there we might have 2,000 or so in the state of Ohio. Of those 2,000, 50 are trucking. And what is the average cost that a trucking company is paying for health insurance? Let's say it's $12,000 per employee. Well, this person is paying $10,000, should feel pretty good about that. But if once we go into there, we say, what's the average deductible that they're paying, they have, and they say it's 1,000 and they're doing a 5,000, well, that might be part of the reason why their cost of benefits is lower. And it could be also part of the reason that they're having problems recruiting and retaining employees. So our benchmarking tool, which normally we charge like $2,000 for, we can do for anybody on this call at no cost. We're happy to do it. It'll be specific to your industry. It'll be specific to our geography and your size of company. And it does medical, dental, vision, PTO, vacation policy, and so on. So it does a real nice job. When you talk about diversity, equity, inclusion, there's a section on there about that asks probing questions on how you're handling it. So if that's something you're trying to do, look in the mirror and evaluate maybe what you should be doing in that area that you're not doing, there's an opportunity to do that. But the point here is that we can give, and you should look to find out setting your baseline. If you understand that your baseline, let's just go back, is $10,000 per employee per year, and everybody else is at 6,000, you should look for the reasons on why that could be. It could be a bad carrier selection. It could be a lack of wellness on your company and things like that. So we're going to show you some of the items on that. So before I go to the next slide, does anybody have any questions or would like me to go any deeper on any of these bullets? Okay, so the second one is alternative care. So when you think about employee populations and the struggle to attract and retain employees, there's two types of employees in any typical group. Actually, maybe three. One be your full-time employees, one you got your part-time employees, and then maybe the third is your transient employees that you never really care about trying to keep around because you just take for a fact that they're transient. Fast food industry might be somebody who has transient employees. They've kind of given up sometimes trying to retain those people. They just know they're going to cycle in and cycle out. But the full-time people, that's where I think, Sherry, you mentioned cost control. That's probably where you're focusing your energies. You're looking to have a really competitive benefit plan. You're looking to be able to attract and retain those people. You're looking to communicate those benefits. But one of the best things you can do to control costs is drive people to the telemedicine and virtual care. Because now they have telemedicine programs that'll cover not only primary care visits, not only, but they'll cover dermatology, they'll cover, all sorts of things. They're very expanded now. And when you think about it, so many doctor visits and doctor care can be covered through there. A really well thought out strategy where you're driving employees to telemedicine first at maybe a $0 copay can save, somewhere between 5 and 7% on your total spend. Because the less people that typically what they say is people that go to a telemedicine, about 15% of those people might have gone to the emergency room, and about 15 or 20% might have gone to urgent care, and the other 60% would go to primary care. Well, telemedicine at 15 or 20 or $30 a visit at cost is cheaper than all those by a big number. So you can save typically 5 or 7%. So the alternative care is a big thrust for our larger companies. And they essentially build it as such that where typically a company will have a copay, which is, you pay $35 or $60 to see a doctor. Then you have a deductible, and then you have co-insurance. They're actually sliding in a new level of $0 expenses. And those $0 expenses are all available through telemedicine, teledoc, dermatology, and so on. And they even have it for, musculoskeletal, orthopedic. They have all those now available in telemedicine. So there's some really progressive things going on in that area. And I would encourage you all to research that a little bit, and you'll see we have some information on that.
Just one other point on telemedicine. It's a great way that to offer basic coverage to your 30-hour and under employees. We can also put an RX plan with it. So it covers, other than having a broken leg or getting your appendix out. I mean, if it covers 80% of situations that occur from a patient's health perspective. So it gives them access to a doctor, it gives them access to an RX plan, and it's very inexpensive. So we have a lot of our fast food clients that are putting that in place just so they can offer something to their 30-hour and under employees.
Yeah,
Bob, so are you saying that an employer can, for a certain class of employee, can offer a strictly telemedical only type of coverage?
Yeah, we have plans that specifically target those employees that are really catastrophic plans, and from a hospitalization perspective, but offer the day-to-day medical needs and requirements that an employee may have via a telemedicine and RX plan. So.
Thank you.
Let me expand on that for a second, Richard. Is that in any ERISA plan, we can create classes of employees. You can have salary versus hourly, union, non-union. You can't have white and pink people. You can't do that. But by geography, by job description, by the way they get paid, we can class them out hours. And what we're talking about here is your groups that are over 30, most companies are going to offer a major medical plan that is going to have a telemedicine built in. Now, to the extent that you've expanded telemedicine within that plan, that's a topic in itself. But what we're seeing a lot of people is they're trying to address the turnover and recruiting challenges in the other under 30. So we put together, and we're not the only people that do it, we put together a package of telemedicine or virtual medical care, RX, and an accident plan that for all three of those things can be delivered at about $20 or $25 a month per employee. So, we see a lot of people, if you think about that, if those people are working 130 hours a month, you're talking about, maybe $1 an hour, $2 an hour, you're able to offer, a pretty robust medical offering. And if that can reduce your turnover by 20 or 25%, you're going to make money hand over fist. Does that make sense?
And the only alternative they have to that is to go down to the marketplace and pay $2,500 a month for access to a major medical plan, which most of them can't afford anyway. So,
thank you.
So some young kid wraps his motorcycle around a telephone pole. Of course, he's going to go in the hospital. There's not much we can do about that. But from the perspective that they get strep throat or they have some type of COVID infection, well, they have telemedicine, they have access to an RX plan. So
if we talk about technology for a second, where we're seeing this used most effectively is, if you think about it, let's go back to attracting and retaining employees. If a company is going to spend, 100 Life Group is going to spend $1 million on their health insurance plan or whatever, if you ask those people, how much are you spending on communicating and educating your people, the value of that? Because it's like if a tree falls in the woods and there's nobody there, does it make a sound, right? If people don't know the value of their benefit plan, how do you expect them to appreciate it? So we have a whole, and again, many service providers do, but we have a whole platform that's based on just educating people on the value of the benefits, how to access their benefits. And one of the things I'll send out when we send this PowerPoint out, I'll send out a demo link for our mobile app, because our mobile app has has all your compliance items in there, and has your schedule of benefits, your SBCs, but it also has a very robust way for people to get educated about benefits, but more importantly, troubleshoot if they have an issue without bringing the company into it. So for example, our mobile app, if you want to go to the health insurance section, you would see, let's say you're with Anthem, a hot link to their 800 number where you click the number, it'll take you right in to the customer service line. Or email them a question right from your phone, you can click that and it'll take it right into there. If you can't get it resolved by there, it goes into our customer service line. So before a HR director ever gets involved with an employee issue, an employee has to, doesn't have to, but will have not have their problem resolved. The information on the mobile app or the connections in the mobile app and so on. The other thing is like the decision support tools. This, you're going to hear a lot more about this. For example, United Healthcare has a new product they call Bind. And what they do with their Bind product is there's no deductibles, there's no co-insurance, everything is copay, but all the copays are driven by the quality of care and the cost of care. So for example, here in Central Ohio, and I'm not saying these numbers are correct, I'm just trying to give you an example. If you're pregnant and you have a delivery, if you go to St. Anne's, it might be $1,000 copay, and then everything is covered. And if you go to Ohio State, it might be $3,000. And the point is that by United Healthcare's data, and again, I'm not saying St. Anne's is better than Ohio State. I'm just using this as an example. St. Anne's provides a better level of care, less readmissions, and a lower cost than Ohio State. So they're driving people to that lower cost, higher outcome right at the point of sale, if you will, right? So they make that decision. And of course, employees are going to vote with their pocketbook. Same thing with orthopedic surgery. A knee replacement might be $500 at provider one and $2,000 at provider two. So when you think about a knee surgery costing $20,000, $30,000, if the difference is $30,000 per provider one and $20,000 provider two, and we can get them go to provider two, we can share a part of that $10,000 of savings. So how do these employees find these things? That's what they call decision-making tools and decision support tools. So that's how technology is kind of changing. And I see that whole market of copay driven and so on is just going to expand and explode, because if you think about it, controlling cost of care a lot of times starts with the decisions that the employees make. You can only do so much in the back office, but essentially the decisions the employees make is really important. Does anybody have any questions about that? Okay. You talk about bridging gaps here. We normally think of bridging gaps of, having programs that will cover your deductibles and co-insurance. That could be an HSA account. It could be an FSA account.
We did have a question from Max.
Okay.
It should be on your chat box there. So before we go on.
You monitor the chat box, Bob, and what do you think Smart Shopper and is showing price differences by service? Okay, so here's the question. What do you think of Smart Shopper and it's showing the price difference by service being provided and paying for the use of lower cost services? So I think there's two parts to that. Is if we could get every employee to use a program like Smart Shopper or Blue Book, which are programs that say, if you go to, I'm just going to use a couple examples here. If you go to Ortho Neuro for a knee replacement, the total cost is $25,000. If you go to Orthopedic One, it's $20,000. I don't know if those are right numbers, but I'm just saying that. And so there's a $5,000 savings if they go there. The problem is, and I think this might be what Max is alluding to this, is that if an employee pays a $2,000 deductible either way, if they're both in network, and then 80/20, that $5,000 of savings is lost on the employee, because they said it's not going to affect me, the difference between 20 and 25,000. Now, if you told me the difference is 1,000 versus $3,000 deductible, that's it. So I think when he says that, can you pass the savings on to the employees? There's many ways to do that. There's many prepackaged ways, like I said, with Bind. But yes, that's definitely where this market is going. me see, good plan of staff knowing the value, take all those costs down. So, did I answer your question, Max, or do you need more on that?
Yeah, you answered it. I personally use Smart Shopper. And they're giving you part of the savings. So I see that as an incentive to the employee to choose between. They don't have to choose between, obviously. If they want to stay with a higher cost provider, they can do that. But if they personally themselves don't see a difference and they can get $500 or $100 by choosing the lower cost provider, in this area here, sometimes the lower cost provider could be OSU. Other times it could be Riverside, or other times it's Mount Carmel. But they get the choice, but they can actually get a lot of their deductible paid back by taking the savings and getting that check.
Yeah, and the advent of HSA accounts or high deductible health plans has really helped in that area, because in the old days, people that are longer in the tooth like me, in the old days you had a copay, deductible, and co-insurance, and so much, about 80% of everything was covered by your copay, your doctor copay, your urgent care copay, your emergency room copay. So whatever happened after that, you really didn't care. Now in HSAs, you essentially self-insure the first 2,000, 3,000, 4,000. So what Max is saying, if somebody says you need to go get an MRI and it costs $500 at place one and 1,000 at place two, and you're in $1,000 deductible, that savings goes right into your pocket if you're in an HSA. And we see a lot of that in the GoodRx type of concept, where people are searching through GoodRx to find lower prices. And the anomaly we see there is, you would think, like, let's just take Lipitor as an example. I know it's generic now, but in the old days, Lipitor might cost, $50 or $60 for a 30-day supply. And you would think that a company like Anthem, Blue Cross and Blue Shield would have this great value on Lipitor. And so they would sell it for mail order at, say, $50 a month. But you could go buy it at Giant Eagle for $15 a month. And it's not because Giant Eagle is getting it for less. They were willing to provide it for less because they know when you go in there, you're going to buy peanut butter, jelly bread, and diapers. And so taking advantage of those things is something that GoodRx or a company like that can expose and provide transparency. But the problem with that is they don't accrue towards your deductible and copays if you fill it outside of the plan. So that actually is something that we expect to be repaired next year. But as we sit here today, most companies won't allow you to get credit towards your deductible and co-insurance at maximum out of pocket if you fill it through GoodRx outside of their PBM, which is the prescription benefit manager. But let me move on.
I would just add in on that, GoodRx. Understand that you're not, quote, getting anything for free from GoodRx. You are paying GoodRx part of your, quote, cost. So when you go into the pharmacy and you ask them to adjudicate that through GoodRx, and let's say it's $10, like $2.50 of that ends up in GoodRx's pocket.
And yeah,
that's where they make their money, why they make $1 billion a year.
Yeah.
So what you want to do is ask the pharmacy to just not adjudicate it, because you can find out the costs without actually adjudicating it to GoodRx and paying them that money.
That's a good point. And again, I think if you look at a GoodRx card or any of your medical cards, they're going to have what's called a BIN number on your RX card, and that BIN number essentially tracks right to the discounts that Mac's talking about. So I think you're going to have to find somebody, they're going to have to find a BIN number to attach that to, or else you're going to pay retail. But there are lower cost providers than GoodRx for the same service.
Just need to go into the pharmacy and ask for their cash price. Mm-hmm. And I own 2 pharmacies. I know the game. Okay. Just go in and ask for your cash price. Don't force the pharmacy to use a GoodRx or your prescription insurance card. Ask the cash price. Remember, it was only until about 2 years ago where insurance companies no longer allowed to force the pharmacy not to tell the patient that the cash price was a better price. I personally suffered this in our pharmacy, where one of my pharmacists told the patient that it was cheaper if they just paid cash. The patient, of course, was upset, went back to their employer, The employer called the insurance company, and 2 days later, we get a call and say, hey, if you do that again, we're cutting you out of our network. We had to pass a law to stop that kind of crap. So patients should just always ask the cash price.
Well, that's a great takeaway. Was that Max talking, by the way?
It is.
That's a great takeaway, Max. I appreciate that input because just goes to show you, I'm, like I said in the beginning, I'm a foot deep and a mile wide. So in the RX, you taught me something today. So thank you for that. Let's just go into the fifth one here quickly, and labor shortage. Now, this is something that I'm sure that many of you are really struggling with, and I would just say, I just saw that the most current stat is that the unemployment rate's about 3.5% nationwide. I don't know what it is in Ohio, but it's got to be close to that, or maybe even worse. And they said that there are 2 jobs available for every worker out there in the United States. So when you talk about that cost push and demand pull inflation, when you talk about wage inflation, you can expect that that's going to aggravate an already difficult situation. We've been very fortunate here at, we have 120 employees here at our office in Columbus, and we've been very fortunate. We haven't had a lot of turnover, but I know that a lot of companies, people are, the people that you need to hire, or people that are being hired, are already working somewhere else. And so to jerk them away from their bowling league, to jerk them away from their, social circle and things like that, usually requires a pretty significant investment or incremental wage thing. And we're just seeing a lot of wage inflation out there. I would just say that the only way to really battle that is have a fantastic communication package on the value of your benefits and the value of working for your company, and spend time on that. We have a resource at USI. She used to be the communication director for Kroger. And so she sits with our employees. She handled 50,000 Kroger employees that are on their communication. And she says you have to have like an 8-stage communication process. You got to use text, email, and there's a lot of resources out there that allow you to send out one communication and go via text, via go email, via Facebook, like 5 different ways to your people. So a lot of companies are taking advantage of that to make sure their people appreciate working there and really try to get more employee engagement. So,
Tom, hey Tom, so everybody, this is Richard, and I concur with that. Years ago, and I don't think it was our original idea. I think we got it from somebody else, but we began at the end of the year, we provide to each of our employees the value of every single benefit that they receive from Whalen and Company. The purpose of that is really just to put a reminder of the benefits themselves, along with the cost to the company and the value to the employee of those benefits. Because as that was mentioned earlier by Tom and Bob about the insurance benefits, that there's a lot more than that we all provide. And the cost is tremendous. The value to our employees is tremendous. And it's just easy to overlook and forget. So I encourage everybody to consider that. And if you're not doing it and you want an example, we would be happy to share ours.
Great. Yeah, I mean, and I think what you're talking about there is what we call a benefit statement or a total reward statement, where you say, yeah, we're paying you $40,000 a year salary, but it cost us $10,000 a year for the medical. Yeah, you're paying $2,000 of that, but we're paying $8,000. So your $40,000 salary should be included to $48,000. And when you get in the dental, the vision, the life, the disability, retirement plans, what you're paying in Social Security, workers' comp, that whole package,
exactly,
is usually 40 or 50% more than what a person's wages. And if they don't understand that, somebody that comes and says to them, hey, you can come to work with me, you're making $20 an hour over there. We'll pay you $24 an hour, but we don't provide medical. Well, that may not be a good deal then, so just that's a really good point there. And that's right in here in our link here of, customized communications and so on. And then just last thing is I want to go into just because now I want to talk about cost control. You see here, I said, do we forget to mention costs, right? I put this slide in here. So the Columbus Chamber now has, I'm going to call it a scoop to nuts strategy for medical. They had a 2 to 50 life program called a MIWA, which is a Multiple Employer Welfare Association. We get calls all the time from people and say, hey, I'm in the accounting association. I'm in the realtors association. How can we pool these people together and get group pricing at a discount for all our members? Well, you really don't need to, because Anthem has one with the Southern Ohio Chamber Alliance that anybody can plug into. United Healthcare has one with the Ohio Chamber, and the Medical Mutual has one with the Columbus Chamber. So all three of those are multiple employer welfare associations where multiple employers are pulling together. The problem with them is they stop at 50 full and part-time employees. The people over 50 had no solution before about 6 months ago when we launched this product. So the Columbus Chamber now has close the door. The Columbus Chamber now has a program that's a turnkey deal. And what it has is it has a captive. So for those of you who aren't familiar with a captive, they take on the risk between, let's just say, the employee paying a $2,000 deductible, and maybe the next 100 or the next 20,000 or 30,000 might be employer risk, and then the next 250,000 is like the captive risk. So if you look at that, the reason that that's so powerful, that's what large employers do, but usually they say you have to be 200 to 250 employees to do that. This is specifically for that 50 to 250 market segment. And you can see here, this is the percent that you save. So just by going from a fully insured plan to a self-funded with the same carrier, let's say whether it be Anthem, Medical Mutual, United Healthcare, you're going to save about 7% of your premium. If you put in a good wellness program that's physician-based, you're going to save about $600. And if you carve out your RX, you'll save about $600. So just by going into this program without any changes to your deductible, your copay, your network or anything, you could save almost, let's say, 20% on your medical. And then the other savings come over here with some of these other strategies. The point is everything you see on this list here is a list of the things that large companies do. Every large company that we work with is doing all this. They're self-funded. When I say large, I'm going to say over 250 lives. They're self-funded. They have a physician-based wellness where employees have to have a physical exam every year. They've carved out the RX so they get all the discounts. They control the spread. They usually have a strategy to put people on Medicare if they're over 65. And if they have a spouse has coverage through another employer, they do a spouse waiver. They have a captive or stop loss contract. We talk about the Blue Book transparency. They have a high deductible health plan, and they have a good administration package so they don't have situations where people are on coverage that shouldn't be. So if you think about that, the wheel, you can just kind of look in a mirror and say, am I benefiting from all these? And if I'm not, there literally is 35% of the savings there. And that's why when people say, well, I want the savings that a large company gets, it's because they have an accountable plan where they're willing to unbundle this and watch it. So the chamber has a turnkey program available. And if anybody likes more information on that, we'd like to present it, but that's not the point of the slide. The point of the slide is these are solutions and estimated percentages for what you could save on these different programs. Does anybody have any questions on that before I move forward? Because that was a lot in a very short period, but I think you guys are probably sophisticated buyers enough to have been down this road with these different topics. But if not, here's a slide that you can look at that we'll send out to y'all. And there's a flyer on there that I'm going to include in there as well. And finally, I just want to talk about compliance. I always tell people, you can take one step forward and two steps back very easily. if somebody comes to us and say, hey, I'm spending $1 million on my benefits, can you save me 10%? And we go through that and we save them $100,000, but they haven't filed 5,500 forms. They don't have an SPD. They don't have a wrap document, things like that. The average company that was audited for health and welfare, 75% of them failed the audits last year, or let's say 2 years ago, and the average penalty was $425,000. So if you don't have a solution for a compliance program, that is really important. And whether it be your attorney, your accountant, your broker, or whatever, I really encourage you to take a hard look at your compliance program. This is showing you some sample penalties for an employer with 500 employees. If they're delinquent for filing their 5,500 for just 180 days, that's $432,000. I've had companies that have been delinquent for 13 years. They said, I don't have to file one because I'm a church plan or some other reason. They don't do that. So the point is, I'm going to show you in the next slide, really kind of a good self-audit tool. I'll make this bigger for you. This is a list of essentially all the documents that you need to have in a library available if the Department of Labor calls you for an audit. All right, so you have to have a disclosure request form, marketplace notice, summary of benefit coverage. Sometimes these documents are covered by the insurance company. Sometimes your accountant might be doing it because they might do your 5,500 forms and so on. But ultimately, as the plan administrator, you're responsible for each one of these. So what I try to tell people is that you're responsible for maintaining a library of these documents. I know that's hard to see. And then this is when they're due, right? So upon hire, newly eligible, within 90 days, upon the event, and annually. So this is we're happy to give this. I would appreciate it if you don't give this to any of our competitors, because this is a very valuable document, we feel. But if you'd like to use this as a self-audit and you feel like, gosh, I don't have some of these or so on, certainly we'd help you out or bring it to the attention of your advisor or whatever. So we got we're pretty much at the end of our hour. And what you'll see in the rest of this slide deck when I send it to you is we'll have an appendix back here. So everything that is in there, if you would have clicked the blue thing that said benchmarking, it would take you to this information slide. If you click the thing that said custom employee benefit communication, it would take you to the slide. I apologize that this says USI on it, so I don't take this as like advertising and promotion for our company. This is really just information on what's available out there from us and other brokers, and you should make sure you take advantage of it if you can. So with that said, I'm going to stop sharing and go back to the screens and just see if anybody has any. I see them in the light there. Does anybody have any questions or want to open discussion or anything I can help you out with, or Richard or Bob?
Tom, Max Peoples had a question about on the compliance side of the equation. All the documents that you showed. Is that for any size company?
Yeah, there's some, like obviously like an FMLA disclosure is only required for groups over 50 lives. So some of those, and then like an annual 5,500 filing is only for groups with over 100 employees on any ERISA plan. And by the way, we see people all the time say, well, I only have 60 people on my medical plan, but they have 150 people on their employer paid life plan. Those people have to file 5,500 forms. So those are some of the people that have gone on for years without doing 5,500. But to answer your question, Max, it's really segmented under 50, 50 to 100, and 100 plus all have different compliance zones and different compliance requirements. The checklist that I showed you is for a group over 100.
Do you have a checklist for under 50? Did it make any difference for like folks that have 20 or 30 employees versus?
Yeah, what I'll do is I'll go ahead and Bob and I we'll send we'll take that list and we'll pare it down. We'll take things that aren't necessary for groups under 100 and we'll give that out. The only thing that would be, we'll do that. We'll get that to you. We'll get that to you.
I think that'd be helpful for everybody who's, on the smaller side.
Sure.
to
And I
work.
expect that many are on the smaller side. So, just know that we certainly serve 2,000 to 2,000 life groups. So if you want some advice, by the way, take advantage of that benchmarking that we do. We'll send a sample of that out to you. It's really good executive information. It takes a little work on your side just to, populate maybe 10 different questions. But once you do that, it's a real valuable thing. And we'll send a sample out with the follow-up email. So I'm going to send, Richard and Jacob a packet and allow them to send it directly to you. And then if you guys have any questions, obviously we're here to answer your questions. We wouldn't be doing this if we don't want to expand our presence, expand your knowledge, but we definitely would love to have the opportunity to work with any of you. But if you want to just use it for information, we're happy to do that too. So
Thank you much.
Well, wonderful.
any other questions?
Oh,
Any other questions? Well, Richard, Jacob, do you want to wrap up?
yes, that'd be lovely. Thank you guys so much for presenting. Like Tom said, once he sends over that information on the presentation, I'll make sure to send out those packets to you guys. We also recorded the session today, so if you came in a little bit late, that recording will be made public. I'll send that out to everyone, and you can review what you may have missed. And thank you everyone for joining.
Perfect.
Thank you.
Thanks a lot, everybody.
Thank you very, very much. It was a great presentation.
Go Buckeyes and Notre
Go
Dame
Bucks.
if you're a Notre Dame fan.